Namaste. I am Dr. P.K. Shantakumari, the Chief Physician of Vata Ayurveda Eye Hospital, Tirunelvelim. Today I am talking about an eye condition known as Posterior Vitreous Detachment, commonly known as PVD. Vitreous humor, otherwise known as vitreous gel. It is a semi-fluid structure, almost a gel in shape, is the structure which fills the posterior segment of the eyeball. And this has a very particular property and function. It is to keep the size and shape of the eyeball normally intact. So when there is any defect to this structure, it will lead to so many conditions pathologically. So actually it is seen that this happens as age related, as a senile change. Anyway, the senility is not avoidable, but the deteriorations and degenerative changes that happens due to senility is not like that. It is avoidable. So we have to think of it. Now coming to the properties of vitreous, it is actually this vitreous supports the retina which lies posteriorly. Retina, we know this is the most important structure of the eyeball, which lies in the posterior boundary of the eyeball, inside. So the light rays reflected from the object externally, it is travelling parallel through the air and then reaches eyeball. When it reaches the eyeball, it passes through the various refractive media of the eye, inside the eyeball, and it is refracted in such a way that it converges or focuses on the retina on a particular point. And when this happens, that means convergence, a series of reaction starts. First is photochemical, then electrical, then nervous, and the final outcome is a nerve impulse which carries all the details of the external objects. This impulse is carried out through the optic pathways to the brainstem, and there this impulse is processed to develop the actual visual sense. So from this it is very clear the importance of retina, and this retina is supported by vitreous anteriorly. So whenever there is a pathology or a defect in the vitreous humor, it directly affects the functions of retina, and then it develops different types of signs and symptoms. The main symptoms are blurring of vision in general, and then seeing flashes of light in the visual field, then floaters, and general decrease in the vision. So coming to Ayurvedic aspects, the vitreous gel as such, structurally, anatomically, and physiologically, it is having the dominance of Kapha. We know Ayurvedic principle is based upon three main factors, Vata, Pitta, and Kapha, and each one is having its own characteristic features and its own physiological and anatomical and functional properties also. So vitreous is having the dominance of Kapha, and among the various properties of Kapha, the particular properties such as Picchila and then Snigdha and then Sthira, these are more important in the case of vitreous. So when this is affected by any reason, it will make some defects or some pathological changes in the vitreous humor. And so it is important to understand how this will be vitiated. In the case of this PVD, this vitreous fluids is vitiated by Vata. Vata is having almost opposite properties of Kapha. Among the different properties of Vata, Ruksha and Chala and Sukshma, these properties are capable of vitiating vitreous to develop PVD. That means when Vata is aggravated by the properties of this above said Ruksha, Laghu, Chala, like that, and it is affected on the vitreous, it is capable of making some defects, which is capable of developing PVD. Then what happens? The vitreous starts to shrink or to make it thin, and then there is a tendency to make it more thin and changes its constitution, and then there is a possibility of detaching it from the underlying retina. This is the factor which lies in the underlying theory. Then coming to the treatment side, we can understand that the overall aim of the treatment should be to maintain the properties of Vata so that it will not vitiate vitreous. So in the treatment side, to make the properties of Vata normal is not an easy task, because the properties of vitreous is Kapha, and so we have to maintain that, and in such a way that it cannot be vitiated by Vata. So there are so many treatment procedures and medicines, external and internal, to achieve this goal. Among the external procedures, Shirodhara and Shirovasti, then Brahmananasyam, etc. are more important. And these things will maintain the normal properties of Vata and Kapha. And then if we think of the medications in the eye, the most important one is Tarpana, and then Netradhara. So if we are doing these two types of treatments in the eye and external to the eye, with the appropriate medicine, that is more important. These are all only the name of the procedures. The result or outcome is from the medicines we are using for that. All the taila or ghee used for this procedure should be medicated with the appropriate ingredients or drugs. Then only we can it will serve the purpose. So if we are doing these treatments in the correct way, the vitreous detachment can be controlled. So the more important one is to identify or diagnose the condition in correct time and the correct way. Then while handling these conditions, we have to take into consideration one more thing, because we have already seen that most probably this is age related. So other systemic conditions such as diabetes, hypertension or cardiac problem should be considered. So steps should be taken to control this situation also. And also there is chances of having other ocular pathologies as a result of senility. Here comes the main things, macular degeneration and glaucoma, like that, and other types of retinal degenerations. So when we consider PVD, we cannot forget all these things. We had to consider and maintain the other systemic conditions and other ocular conditions also in such a way that it will not affect the treatment of posterior vitreous detachment. So if you are taking everything seriously and doing the treatment according to correct Ayurvedic theory, it is manageable and can be controlled by medications. Thank you.